I've been a hospice nurse for about 4 years now.
I've been a hospice nurse for nearly 9 years.
I worked in the hospital for 10 years and then going on 18 in home health and hospice.
I retired and I wanted to give something back to the community, and I've just always thought that hospice was a good program.
We used hospice when my husband was ill, and we thought it was a good way for me to pay back what we received from them.
14 years ago, my mom was diagnosed with lung cancer, and we used hospice because my brothers and I lived out of state, and I liked it so much I knew I'd be paying it forward someday, so now I am.
I feel honored to work with hospice because I had them for my husband and my grandmother and my mother, and it's like an honor and a privilege to be able to work for them now, to give back to the community what they have done to me.
I've been a home health nurse for 20 years. It is, and I tell this to everybody, it's pretty much my dream job.
You come to home health and you find out that it truly is a dream job, because where else can you be with a patient, you know, in their own environment.
When you see people in their home, it's a whole different ball game.
My husband was on hospice and he was at home, and our grandkids, they could just come and just be themselves. We didn't have to worry about them being too disruptive to somebody else. They could yell and holler, and you know, if they cried or whatever.
You're in their territory, they're more in charge. It's all about establishing a rapport with people.
So you get close to them and become a part of their lives.
You're not a number. You get into your big hospitals, you're a number. And they don't know your name or nothing.
It was way beyond what I ever expected hospice to be.
You're not only involved with the family, but you're probably involved with their pets.
They don't have to always call the physician if there's changes for like medicines, because we're there. And so they can just be the, you know, the daughter or the son, and it relieves a lot of the stress.
Having the farm to oversee and making sure that things were going right there was quite a stressful situation, and they really helped me. And they helped my husband. They gave him the peace that he knew that I was going to be taken care of. And that meant a lot to him. Meant a lot to me too.
They were very good as far as figuring out when the caregiver was approaching burnout. And believe me, being the primary caregiver along with my mother, there were times where they could sense that we were stressed.
They knew what was happening or what the next steps were going to be. They'd been through it before, and they knew how to prepare us for each step along the way.
A lot of times they'll ask me questions, and I'm able to kind of tell them how I dealt with it and how I felt.
They know someone is coming in to help them, to explain things to them, and to be there just to support them. And we are on call 24 hours a day, so they can call if there's any problems or concerns. And I think it's just the fact that they know someone is there.
A lot of times regular health care just focuses on the physical needs, and hospice focuses not just on the physical, but the psychosocial, the emotional, the spiritual needs.
And we have equipment, you know, that we can help as they decline. The hospital beds, walkers, commodes, wheelchairs, oxygen if they need it.
You know, you could have home hospice, you could have in-hospital hospice, you know, and I think both of them, the nurses and the personnel that facilitate that have been taught what it means to have a dignified death.
Once they're in-house and the pain is manageable, it was like you could see an inner peace come over them too.
I had a patient that was having a hard time letting go of her family members, and she was lingering, and one day she said to the nurse that we had, happened to be another nurse, that she needed some help in letting go. So she asked the nurse to get her scissors, and she visualized a string with each of her family members that were sitting around her. And so the nurse gave her scissors, and she cut each of these strings, and she was just able to, you know, feel more at peace about that. And she goes, now I'm ready. And she passed away the next day.
You feel real sadness when they leave, but I always feel that they've had a peaceful ending, and that's good for them and the family.
When I first started, we didn't have that support for family members. Now with hospice, we have that support, and we follow up to 13 months after a patient passes away.
One of the things that was greatly beneficial to not only myself but to the rest of the family was the bereavement counselors.
The funding, sometimes we don't even break even with some of the patients that we have, and so that's why we need to have the fundraising to help us to at least break even or remain viable in our community.
I would like to see more people volunteer because they don't know what they're missing when they're not volunteering. I think as a volunteer, I get more out of it than what I give sometimes.
It's just as rewarding for us to be in their homes as it is, you know, hopefully for them.
A lot of people are in awe that I can do this. They think, oh, I couldn't do that. But I try and tell them that it's very satisfying that you can make somebody happy in their final days of their lives and make them laugh, and that's my goal.
I always used to joke and say, I don't know how you ladies get dressed every day trying to get those wings stuffed in those smocks, but you manage.
It just gives you such a good feeling to know that you've been able to help someone.
Trying to help somebody, you'll get it back in your heart 1,000-fold.
I really can't imagine doing anything else.
I really admire the work they do. It's very meaningful.
We can't add days to your life, but we can add life to your days.
No, I couldn't ask for any better than Prairie, my favorite hospital.